Because I remember at the beginning, when I was working on bone expansion, it was still difficult to convince the people that I was working on bone expansion. But the problem was when I say, okay, I can understand because maybe some implantologists have skills about osteotomes. But they say, okay, in width, I can understand. But it's impossible to gain in length. Not at all. For the same reason, exactly the same reason. I'll give you an example. Molar site, 6 or 7. I want to place my implant, native site, native bone, right? So, healing site. I'm doing the osteotomy. I want to place length 10. 10, that means, in my case, I will place my implant under the bone level 2 millimeters. That means 10 plus 2. I will make my bone bed preparation up to, depending on the density of the bone, but we know that molar site is mainly density 4. So if I have a real density 4, so I will stop maybe at, if I want to place this 10, I will stop at 8. Again, it depends on the design of the implant, and this is why this is so critical. Because if you have an implant that is tapered, okay, this is a good choice. But if your implant doesn't have aggressive enough threads, there's no way. Again, this example of the screws. Try to put a screw, a tapered screw, in this piece of wood. Well, this is conical. But if the threads are not so aggressive and deep enough, there's no way of getting in. And this is physical. Then translate it to biophysics. That means that your implant need to be tapered, but at the same moment, self-threaded. And this is the way you can get inside your cancellous bone. Yeah, exactly. But I rather prefer to gain of bone expansion. A second example, you probably have done some graft procedures, like the chin, or symphysis, or retromolar. Since you pass the cortical, we know that the cortical is very dense there, and there as well. Sometimes 3-4 millimeters retromolar gene. But since you pass it, it just, usually I like to take this example. It's just like the trunk of a Cadillac. You know the Cadillac, this old American car? You know, and usually the trunk is like, you know, banded, it's strong and very heavy. But you open it, it's empty, it's nothing. This is what happened here and there. So, yeah, sure, of course.
Ladies, any question from your side? Yes, please.
Before that the case it have vertical distortion of the bone, okay, but the problem that it's in the maxilla, okay, and I repeated, I tried to make it with the membrane and all, and it's not, it's failure case. How I can remove it without I make more damage to the bone, and I can replace it immediately, or how I can manage the case after?
Yeah, it's a very interesting question. Short answer, it's not easy. So the question is in compromised site. And you place an implant, and I presume this implant is also integrated, right? But partially, right? And you want to take out this implant, and knowing how you can restore this region. And we are under the sinus, or Okay, the thing is that GBR technique, on this case, will fail. This is 100% sure. There's no way. You will make a good X-ray in grafting, in GBR technique, in utilizing whatever kind of bone substitutes. But then after a few months, it will fail. It will collapse again. Well, the only option that you have is take out this implant, right? Taking out this implant, you have different options. My option, again, would be to use an erbium laser. This erbium laser, because it's so thin, it will make just the osteotomy few microns around this implant. That means that because we have to think about the restoration, placing another implant. So now it depends on what kind of, or what is the width and the height of your remaining heart tissue.
Can we ask that this discussion is then somehow continued later on between both of you? There was a lot of questions. I thank you very much for your interest, Dr. Khalid, Dr. Samer, everybody here. But you know, even the hotel gave me a sign that we have to close because the dinner has to finish before midnight. Otherwise, we'll never end. Dr. Chamonix is so nice. He's ready to talk till he flies to Riyadh tomorrow at 6 a.m. So can I ask the ladies to start to the buffet? The ladies first, please, to the buffet.
This is so painful for me that
I'm sorry, but then
I cannot show you all these cases because really very interesting cases. Yeah. Yeah, I know.
من أهل المدينة دكتور إبراهيم ما شاء الله تبارك الله شرفتمونا. اللي ما يعرفني أنا الدكتور عبد الرحيم قاري طبيب بشري مو طبيب أسنان. نشط في مجال كده شوية بعيد عنكم هيماتولوجي أونكولوجي. والحمد لله الله وفقنا وسوينا مؤتمرات في الهيماتولوجي أونكولوجي في هذه القاعة عدة مرات وفي أماكن ثانية كمان، لكن هذه المرة الأولانية اللي بنسوي مؤتمر في طب الأسنان. قبل سنتين أسست شركة وأخذت وكالات في طب الأسنان وغير طب الأسنان كمان الحمد لله. واحدة من الوكالات اللي الحمد لله يعني لقيت قبول عندكم هي شركة أنثوجير. أنثوجير معروفة في مجال الأسنان، بتنتج انسترومنتس كثيرة وبتنتج عندها كمان إمبلانت سيستم. أنا أعتبره إن شاء الله على قد ما أقدر أقول إنه جيد، ما أقول إنه أكثر من جيد. فالليلة إن شاء الله حيكون عندكم فرصة تطلعوا على الأنثوجير سيستم هذا وتأخذوا فكرة عنه بإذن الواحد الأحد. جبنا بروفيسور جيل شوموني who is unbiased، يعني حيتكلم scientifically، فإن شاء الله حتستمتعوا أيضا بمحاضرته. أنا بنفسي سمعت له محاضرات له في فرنسا. Few words in English. I welcome everybody that you came here, the ladies also. Whoever doesn't know me, I'm a medical doctor, active in a field a bit away from dentistry, hematology and oncology. I could organize few meetings in hematology and oncology in various hotels in Jeddah, including this one, the same hall. But this is the first time that we organize something in dentistry. A few years ago, I could create a company to import medical devices. And one of the companies which I'm proud of is Anthogyr, which has many, many products in dentistry, but also a very, as far as I can judge, a good system in implantology. So tonight you have a chance to listen to a well-known figure in France, Professor Gilles Chamonix, who will talk unbiased. You will learn from him a little bit of science. And then we, over 10 or 15 minutes, will introduce to you also the Anthogyr implant system. So again, I welcome everybody.